Alberta Health Services. Healthy Albertans, healthy communities, together.
And good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. I want to take a moment to mourn and honor the 215 Indigenous children whose remains were found near the site of Canada's largest residential school near Cranbrook, Kamloops, BC, pardon me. Alberta Health Services and this board stand together with the families and communities who love these children. AHS has lowered flags to half-mast at all of our sites to honor the memory of these 215 children and the others like them who did not return home. I know that for many, this discovery has brought back memories of their own traumatic experiences in residential schools. Their stories and this recent finding underscore the fact that all Canadians have a solemn duty to truth and reconciliation. In that spirit, I would like to acknowledge that the work of AHS takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples, who form an important part of our healthcare system. Our board members are joining us from across the country, and we acknowledge the Indigenous peoples' territories in which they live and work. We are grateful to those who have come before us, and we are mindful of those who will follow us as we steward and protect these lands. AHS and this board also mourn with our Indigenous communities and vow that our actions will continue to be guided by the calls to action from the Truth and Reconciliation Commission. Before I address some administrative matters on behalf of the AHS board, I would like to note that last week was Alberta Rural Health Week, as well as National Paramedic Services Week. I would like to pass along on behalf of Alberta Health Services Board respect and gratitude to everyone who delivers or supports the delivery of healthcare services in rural and remote communities, as well as to our EMS staff who respond to Albertans, often in crisis, each and every day. We appreciate the special skills you bring to Alberta Health Services, and thank you for being there for Albertans across the province, wherever they choose to live and work. Next, I would like to invite AHS's President and CEO, Dr. Verna Yu, to make a few comments. Verna?
Thanks very much, David, and good afternoon to everyone. I'd also like to acknowledge the collective grief we are all experiencing with the news of the loss of so many Indigenous children's lives and the impact on their families and communities. Many of you may be wondering, what can you do? The first step to reconciliation is awareness. We have been directing our staff the numerous resources and training we have around Indigenous awareness, intergenerational trauma, and reconciliation. I also encourage all of you to take part in this month's activities and sessions to mark National Indigenous Peoples Month. Throughout June, we will be hosting online presentations and encourage you to share your stories of strength and resilience online through our Together for Health page. And although David said this earlier, I want to also affirm that AHS will continue to be guided by the calls to action from the Truth and Reconciliation Commission. I now want to spend a few minutes talking about COVID-19 immunization here in Alberta. In short, we're doing well, and we need to help encourage all Albertans to be immunized as soon as possible. More than 2.75 million doses have been administered, with almost 2 million Albertans having received their first dose of vaccine, and more than 375,000 having received both doses. Recently, we've also seen Alberta's numbers of active and new cases drop significantly from week to week. We're making good progress, but we can't afford to become complacent about vaccination or the virus. I encourage all Albertans to get their first dose of vaccine as soon as they are eligible, which is open to everyone now, no matter what vaccine option is provided. Moderna, Pfizer, and AstraZeneca are safe, effective vaccine products that provide protection from the COVID-19 virus and will help make symptoms less severe for those who do contract the virus. It is also important to get your second dose when you're eligible. Earlier today, Alberta Health announced a timeline for these second doses. So anyone vaccinated in March or earlier can book their second dose starting on June 1st, which is right now today. Anyone vaccinated in April can book their second dose starting June 14th. Anyone vaccinated in May can book their second dose starting June 28th. Where possible, AHS and participating pharmacies and physician offices who administer the first dose will contact Albertans to remind them that they are eligible for their second dose. However, Albertans do not need to wait to be contacted to book once they become eligible. Albertans who receive the first dose of AstraZeneca will have a choice. Book a second appointment for AstraZeneca by using the AHS online booking tool or calling 811, or book an appointment for Pfizer or Moderna vaccines through participating pharmacies or AHS. All vaccines are safe and effective, and whatever vaccine you get, second doses significantly increases your protection. So I urge everyone to sign up for an appointment as soon as possible. I also stress that all Albertans, regardless of how many doses they've received to date, must continue to follow public health guidelines, including physical distancing, practicing good hand hygiene, masking when in public, and staying home when sick. Finally, I really want to pass my gratitude to everyone involved in the vaccine rollout. This is and was a mammoth and complex endeavor, and yet overwhelmingly we're hearing Albertans marvel at the speed and efficiency of their vaccination experiences. This is a testament to the dedication and professionalism of our teams throughout the province. They are doing a great job, and I'm sure Albertans are grateful for their efforts. Thank you, and back to you, David.
Thank you, Verna. Now on to the business at hand. We are participating by teleconference today. When I ask for a vote on the motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Tony Dagnoni move.
Thank you, Tony. Will someone second the motion?
Deborah Apps, I'll second the motion, Mr. Chair.
Thank you. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. In the board materials, there were two sets of minutes for approval, minutes from the April 21st, 2021 and the May 4th, 2021 public board meetings. May I have someone move approval of the minutes?
I'll make that motion, David Carpenter.
Thank you, David. Will someone second the motion?
Tony Dagnoni.
Thank you, Tony. Any further discussion? Any opposed or abstentions? The motion is carried and the minutes are approved. We'll now ask Glenda Yates, Chair of the Quality and Safety Committee, to present the Quality and Safety Committee report. Glenda?
Thank you. The Quality and Safety Committee met on May 19th, 2021. The committee received and reviewed the Q3 2020-21 Patient Safety Report, and we also received an update on the status of the Alberta Surgical Initiative. The committee also received risk report updates with respect to patient experience and patient safety, and received and reviewed the response to the Auditor General report on CT and MRI services. The committee received an overview on the Continuing Care Quality Plan and the Continuing Care Health Service Standards Audit, and an update on accreditation activity. We also received an update on the COVID-19 vaccine rollout in the province. There were no items that came through the committee for board approval. Thank you.
Thank you, Glenda. I will now ask Vicki Yellow Oldwoman, Chair of the Community Engagement Committee, to present the Community Engagement Committee's report. Vicki?
Thank you, Chair. The Community Engagement Committee met on May 20th, 2021. The committee received presentations from both the Peace Health Advisory Council and the Stollery Children's Hospital Foundation. The committee also received an update on processes for foundation-funded projects and a Community Engagement Committee of the Board update. I am presenting two motions today for board approval. The committee considered the appointments of advisory council members and the appointment of trustees to established foundations. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. As is our typical practice, given the number of appointments and renewals, the names of the members and trustees will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly following this meeting. First, the appointments of members to advisory councils. The responsibility to appoint advisory council members lies with the AHS board. The committee recommended the board approve the member appointments as reviewed by the committee. The board has considered such recommendation, and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the 7 new Health Advisory Council appointments effective June 1, 2021, for the terms reviewed by the Committee Engagement Committee and Alberta Health Services Board.
Thank you, Vicki. Will someone second the motion?
Yes, David, I will second the motion. Sherry Fountain.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. Vicki, you have a second motion.
Yes. Second, with respect to the appointments and reappointments of trustees to foundations. The responsibility to appoint trustees to established foundations lies with the AHS board. The committee recommended the board approve the trustee appointments and reappointments as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and reappointments of trustees to health foundations for the terms reviewed by the Community Engagement Committee and the Alberta Health Services Board.
Thank you, Vicki. Will someone second the motion?
This is Stephen Mandel. I'll second the motion.
Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. I'll now ask Heidi Overgaard, Chair of the Human Resources Committee, to present the Human Resources Committee report. Heidi?
Mr. Chair, this is Saya Zolke, Vice Chair for the Human Resources Committee. If I may present you with the report.
Please do.
The Human Resources Committee met on May 20th, 2021. The committee received the Our People Results Quarterly Pulse Report for Q4 2020-2021, an update on labor relations, the Our People Strategy Refresh and Action Plan, an overview of AHS succession planning, and a presentation on supporting operations through data innovation in workplace health and safety. There were no items that came through the committee for board approval. Thank you, Mr. Chair.
Thank you, Saya, for presenting that in Heidi's absence. I will now ask David Carpenter, Chair of the Finance Committee, to present the report of that committee. David?
Thanks, Mr. Chair. The Finance Committee met on May 27th, 2021. The committee received financial updates, the draft AHS 2020 to 2024 Health Plan and Business Plan for review, and updates on the 2021-2022 COVID forecast, the AIMCO transition, and a report from the Asset Optimization Committee, which is a subcommittee of the Finance Committee. The committee reviewed several recommendations for board approval as outlined in detail below. I'm presenting 4 motions for board approval today. The committee reviewed the Q4 2020-2021 investment report and recommended board approval. The board reviewed the report and the members support the approval. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described following. A. As at March 31, 2021, AHL's held restricted and unrestricted funds managed by Phillips Hager North Investment Management and Manulife Financial, totaling $1.613 billion. B. Funds were invested in short-term treasury bills, federal, provincial, municipal, and corporate fixed income bonds, pooled mortgage funds, bond funds, real estate funds, Canadian and global equity funds, and C, all the funds invested during the quarter ended March 31, 2021 were invested in accordance with the investment policy and the investment bylaw. I so move.
Thank you, David. Will someone second the motion?
It's Natalia Ryman. I'll second that.
Thank you, Natalia. Any further discussion? Any opposed or abstentions? The motion is carried. David, you have a second motion.
The committee reviewed the interim authorization to spend for COVID-19 costs for 2021-2022 and recommended board approval. The board reviewed the authorization and the members support the approval. Accordingly, I move that the Alberta Health Services Board authorize Alberta Health Services to incur the following costs for the COVID-19 pandemic response. A, maximum expenses of $914 million for the period April 1, 2021 to August 31, 2021. And B, maximum capital expenditures of $28 million for the period April 1, 2021 to August 31, 2021. I so move.
Thank you, David. Will someone second that motion?
Brian Vazjo, I will second that motion.
Thank you, Brian. Any further discussion? Any opposed or abstentions? The motion is carried. David, your third motion, please.
The committee reviewed a proposal related to borrowing for the acquisition of ambulances and EMS support vehicles and recommended board approval. The board reviewed the proposed borrowing, and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve that Alberta Health Services may A, borrow up to $40 million from Alberta Treasury Board and Finance for a 5-year term to finance the acquisition of ambulances and EMS support vehicles as reviewed by the Finance Committee and the Alberta Health Services Board at the current interest rate charged by the Alberta Treasury Board and Finance at the onset of the loan. B, if required, pledge collateral as security for such borrowing as determined by Alberta Treasury Board and Finance. C, repay the Alberta Treasury Board and Finance loan and interest from Alberta Health Services funds assigned to annually internally funded capital asset replacement. And D, delegate the authority to the Alberta Health Services President and CEO to execute all documentation that may be required to put into effect the foregoing on behalf of Alberta Health Services. I so move.
Thank you, David. Will someone second the motion?
Glenda Yates, I'll second that.
Thank you, Glenda. Any further discussion? Any opposed or abstentions? The motion is carried. David, your fourth motion, please.
Finally, the committee reviewed renewals and amending agreements for continuing care facilities and recommended same for board approval. Board approval is required in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The board reviewed the recommendation, and members support the approval. Accordingly, I move that the Alberta Health Services Board A, approve a new master services agreement between Alberta Health Services and Silverado Seniors Village Partnership for 129 long-term care spaces at the new facility in Calgary for a 30-year term on the terms and conditions reviewed by the Finance Committee and the Alberta Health Services Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. B, approve the extension for 5 years to July 31, 2026 of the current Master Services Agreement between Alberta Health Services and Shepherd's Care Foundation relating to the continuing care services at the following facilities: Shepherd's Care Kensington Campus, Shepherd's Care Greenfield, Shepherd's Care Millwoods Campus, on the terms and conditions reviewed by the Finance Committee and the Alberta Health Services Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And C, delegate the authority to the Alberta Health Services President and CEO to execute the new Master Services Agreement with Silverado Seniors Village Partnership and the extension of the Master Services Agreement with Shepherd's Care Foundation as so approved by the Alberta Health Services Board on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, David. Will someone second the motion?
This is Vicki Yellowwold, woman. I will second the motion.
Thank you, Vicki. Any further discussion? Any opposed or abstentions? The motion is carried. David, would you, in your capacity as Chair of Audit and Risk Committee, also present the report from that committee?
Thanks, Mr. Chair. The Audit and Risk Committee met on May 27, 2021 and June 1st, 2021. In accordance with standard practice, representatives from the Office of Auditor General and KPMG attended both meetings. At the May 27, 2021 meeting, the committee received drafts of the 2020-2021 annual report and the March 31, 2021 consolidated financial statements and the financial statement discussion and analysis. In addition, the committee received a report on outstanding and implemented audit recommendations and the 2020-2021 performance report for internal audit and enterprise risk management. There were two items presented to the committee to be considered for board approval. The committee reviewed the 2021-2022 internal audit and enterprise risk management department plan and the 2021-2022 provincial continuing care audit team plan. The internal audit and enterprise risk management department plan outlines the audits and advisory projects to be conducted over the next year, which will focus on key organizational strategic priorities and risks. It also includes the department's goals, strategies, performance measures, and budget. The provincial continuing care audit team plan focuses on the planned routine and high-risk audits of continuing care services and programs across the province in the next year. The plan also includes goals and priorities to improve the effectiveness of audit processes. The committee recommended that the AHS board approves both plans, which were reviewed by the board. The board has considered such recommendation, and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve 1. The 2021-2022 Internal Audit and Enterprise Risk Management Department Plan, and 2. The 2021-2022 Provincial Continuing Care Audit Team Plan, in the forms reviewed by the Audit and Risk Committee and the Alberta Health Services Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. I so move.
Thank you, David. Will someone second the motion?
Tony Dagnoni. Oh. Deborah.
Thank you, Tony. Is there any further discussion? Any opposed or abstentions? The motion is carried. David, you have a second motion.
The Chief Audit Executive reports annually to the committee on the adequacy and relevance of the internal audit's mandate, authority, and responsibility as defined in the Internal Audit Charter. The committee is responsible to recommend annually that the board approve the Internal Audit Charter. The committee reviewed the Internal Audit Charter update as of May 2021 and recommended the board approve the same. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the updated Internal Audit Charter in the form reviewed by the Audit and Risk Committee and the Alberta Health Services Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. I so move.
Thank you, David. Deborah, would you second this one?
Yes, I'm happy to second that motion, Mr. Chair.
Thank you. Any further discussion? Any opposed or abstentions? The motion is carried. David, you have a final motion.
At the June 1st, 2021 meeting, the committee reviewed the Office of Auditor General report for the year ended March 31, 2021, a draft of the annual report, a report on the annual risk summary, an audit report on IT general control, and legal and privacy update. There was one item presented to the committee to be considered for board approval. The committee reviewed a final version of the March 31, 2021 consolidated financial statements, the establishment of reserves, and the financial statement discussion and analysis. The committee recommended board approval of those items. The board reviewed such recommendation and the members support the approval. Accordingly, I move that the Alberta Health Services Board 1. Approve the internal restriction as of March 31, 2021 of A, $925.563 million to represent the amount of unrestricted surplus invested in tangible capital assets and not available for any other purpose. B, $20.912 million to represent the amount of unrestricted surplus related to insurance equity requirements and not available for any other purpose. C, $63.038 million to represent the amount of unrestricted surplus related to foundations and not available for any other purpose. And 2, approve the AHSA consolidated financial statements for the year ended March 31, 2021, as reviewed by the Audit and Risk Committee and by the Alberta Health Services Board. And B, financial statement discussion and analysis for the year ended March 31, 2021, both for inclusion in the Alberta Health Services 2020-2021 annual report once approved, and both in the form reviewed by the Audit and Risk Committee and the Alberta Health Services Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And 3, authorize and direct management of Alberta Health Services to deliver the consolidated financial statements and the financial statement discussion and analysis to Alberta Health, and to later make them available to the public through the Alberta Health Services website. I so move.
Thank you, David. Will someone second the motion?
I will second the motion. Sherry Fountain.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. I will now ask Sherry, the chair of the Governance Committee, to present the Governance Committee's report. Sherry?
Thank you, David. The Governance Committee met on May 27, 2021. The committee received the Ethics and Compliance Office Q4 2020-2021 report for discussion and an update on the medical staff bylaws and rules review. The committee reviewed the 2020-2021 policy report, a draft of the contracted service delivery decision framework, and the AHS midwifery staff bylaws. There are 2 items for recommendation for approval of the board. First, the committee considered amendments to the AHS board member terms of reference, particularly related to external communications. The committee recommended the board approve the proposed amendments. The board reviewed the proposed amendments and the members support the approval. Once amended, the revised board member terms of reference will be made available on the Alberta Health Services public website. Accordingly, I move that the Alberta Health Services Board approve the amendments to the board member terms of reference as reviewed by the Governance Committee and the Alberta Health Services Board.
Stephen Mandel,
Thank you, Sherry. Oh, great. Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. Sherry, you have a second motion.
Thank you, I do. The committee considered the amendment to the AHS Conflict of Interest bylaw. Specifically, a new section 8.2 is proposed for the bylaw to ensure workforce recognition gifts are not restricted by the bylaw, while requiring AHS to take steps to ensure that acceptance of such gifts does not pose a conflict of interest for AHS or AHS representatives. Accordingly, I move that the Alberta Health Services Board approve the proposed amendment to the AHS Conflict of Interest bylaw to add the new section 8.2 as reviewed by the Governance Committee and the Alberta Health Services Board.
Thank you, Sherry. Will someone second the motion?
Natalia Ryman, I'll second that.
Thank you, Natalia. Any further discussion? Any opposed or abstentions? The motion is carried. Although we have reached the end of our agenda, and I declare the business meeting adjourned, I have one final announcement to make. This is the last board meeting for Glenda Yates and David Carpenter. I would like to thank David and Glenda for their service over the past 6 years. Each of them has made extraordinary contributions to AHS and accordingly to healthcare in this province. I would like to thank them and wish them well in all of their future endeavors. That concludes this meeting. Thank you for joining us. Please be safe and well.
Together, we do amazing things every day.